Hello, I'm Dr. Elliot Hirshhorn of New Life Functional Neurology and Endocrinology in Greenville, South Carolina. We focus on helping patients suffering with chronic health conditions like thyroid disease. In this video, I'm going to discuss stress and your adrenals are contributing to your low thyroid symptoms. You've probably heard it said before that you should reduce your stress levels. We often just brush this aside as general recommendations, myself included. But did you know that stress has a direct effect on your overall health, including your thyroid metabolism? In fact, 2/3 of all doctor visits are for stress-related complaints. Stress is a normal response the body has to a demanding situation. It makes the fight or flight hormones like epinephrine or adrenaline and even cortisol. These hormones make your body respond by increasing blood pressure and your heart rate, as well as making you sweat and breathe faster. Normally, your body recovers quickly after these brief responses. When you have chronic stress, however, problems really start to arise. Let's talk specifically about how stress can impact your thyroid physiology. The first place that stress wreaks havoc on thyroid is actually in your brain. So increased stress manifests as the hormone cortisol. Cortisol, in turn, can have a direct and an indirect effect on thyroid hormone production in the brain. Indirectly, cortisol will mobilize sugar in the blood. Prolonged increases in blood sugar can cause inflammation, which decreases the pituitary production of TSH and then lowers thyroid hormone. But increased blood sugar can also cause an increase in insulin, which will promote an altered immune system response, which can lead to autoimmune destruction of thyroid tissue. That's all indirect. Cortisol can directly impact the thyroid hormone production by also causing dysfunction in the hypothalamic pituitary axis in the brain, which is normally responsible for telling the thyroid when to make more hormone. In each of these cases, lowered thyroid production will cause a drop in overall metabolism and result in typical hypothyroid symptoms like fatigue, weight gain, hair loss, cold hands and feet, and brain fog, just to name a few. Thyroid hormone is produced in two forms, T4 and in T3. Mostly T4 is produced, but mostly T3 is needed. So there's a conversion process of making T3 from T4, and that happens outside of the thyroid gland. This mainly happens in the liver, but some also in the gut and other peripheral tissues. Cortisol from chronic stress can cause this conversion process to slow down. When this happens, your body has less T3 available to stimulate your cells and drive metabolism. If metabolism, let's say, of a hair cell goes down, what do you think is going to happen to that hair cell? It falls out, and that's why hair loss is a common symptom of thyroid disease. In addition to slowing conversion of thyroid hormone in the liver, stress can also slow the clearance of estrogen in your liver. So what happens when you have too much estrogen? This leads to an increase in a protein called thyroid-binding globulin. You can think of it as a bus that carries your thyroid hormone all around your body. If there are more buses, more thyroid hormone will be on them and there will be less available to drive metabolism. Again, lowered metabolism equals thyroid symptoms. By the way, what other ways can you have high estrogen that can lead to the same symptoms with these extra buses? Things like birth control, hormone replacement therapy in menopause, just to name a couple. Finally, I want to talk about how stress and cortisol can impact the very end of thyroid metabolism. Let's say that all the prior steps of making thyroid hormone and converting are working very well. The thyroid hormone gets into the blood and it goes to a cell. It tries to activate the cell, but the cell is resistant to the thyroid hormone. This can also cause hypothyroid symptoms. Think of it this way. Let's say thyroid hormone is a key. On all of your cells is a lock, and only thyroid hormone can open that lock. When the key opens the lock, the metabolism of your cell runs normally. When it doesn't open the lock as much, your metabolism goes down and you end up with hypothyroid-like symptoms. So for this situation, let's say the thyroid hormone, the key, makes it to the cell. The key goes into the lock, but it won't turn. No opening the lock, no driving of metabolism. Stress can make the lock not turn. So if all this stress can cause all of these problems in your thyroid metabolism, what can be done about it? Well, you have to reduce and eliminate the stressors. So the question is, what are common stressors? Well, they can include lifestyle stresses, of course, like financial worries and job changes and relationship troubles or the illness of a loved one. But they can also be metabolic stresses like gut infections, leaky gut, food intolerances, blood sugar imbalances, anemias, autoimmune disease, inflammation, environmental toxins. If any of these stressors is impacting your thyroid metabolism, they must be addressed. Okay, have I stressed you out enough about how much stress is stressful to your thyroid? Well, guess what? There is hope. If you have thyroid symptoms and you want to know if stress is contributing to the problems and how I can help you, contact my office today at the phone number below to schedule a consultation to see if you qualify for care. Thank you and have a great day.